Over 5 years ago, we started thinking about what technologies do we think are going to be game changers for radiation therapy. And we came to the conclusion that MRI guidance is really going to be the thing that can make a huge difference for our patients.
We guide most of our radiation therapy using CT scans or simple X-ray films. CT scans are very good at imaging parts of the body, but they're not so great at imaging soft tissue tumors.
Magnetic resonance imaging allows us to better differentiate normal tissue from cancer. This new technology that we're bringing to the Dana-Farber Brigham and Women's Cancer Center guides the radiation therapy using MR technology.
The MRI-Guided Radiation Therapy program has two main components. One component is the MRI Advanced Procedure and Simulation Suite, or MAPS. And this is a high-field MRI scanner with a specialized immobilization setup to image a patient before their radiation therapy treatment.
One of the key parts of radiation therapy planning is to put the patient in the same position each day. The advantage of the MAPS is now we can obtain the MR in the treatment position and use that to plan the radiation, and that's why it's so different from what other centers are doing.
One other thing that the MAPS suite will really help us to do well is delivering high-precision brachytherapy, procedures where we implant radioactive sources inside a patient to treat their disease.
The second component is the MR-Guided Linear Accelerator, or LINAC. MR imaging is actually married to the machine that administers the radiation.
That combination has never existed before, mainly because those two devices aren't meant to live together.
A linear accelerator generates a lot of radio waves. At the same time, in an MRI imager, we're looking for very faint radio signals that come from the human body. And so a lot of technological development has gone into being able to shield these devices from each other so that they both work together. This allows us to treat with radiation while visualizing directly in real time and to change and adapt our radiation therapy plan on a day-to-day basis.
Historically, planning takes us as long as 3 to 5 days. With this MR-Guided Linear Accelerator, we can actually do that in an hour. So we're able to adjust the radiation based on the conditions of the day. And the reason why that's important is that the tumors don't stay still.
The anatomy of the patient changes from day to day and second to second. As the patient breathes and the tumor moves up and down and up and down, it might move in and out of the field of radiation. In fact, very critical structures might move in and out that we don't want to have radiation, be it the intestines or the stomach.
We can actually automatically have the machine turn the radiation off if the tumor moves out of the position that we want it to be in. That allows us to really make sure that within millimeters, we're treating where we want to treat.
We can treat a much smaller area much more accurately and deliver higher doses of radiation and increase the likelihood of controlling the cancer. That means shortening the treatment course from 7 to 8 weeks down to 1 to 2 weeks.
We're among one of the first centers in the world and the first center in New England to have this new technology. One of the things we're really trying to do with this device is to figure out where it makes the biggest difference and for what patients.
The patients that we're going to be able to help right away are the ones that we can't even treat right now with our existing technology. Pancreatic cancers, some head and neck cancers, some brain tumors, certain lung cancers. And our referring docs, when they see the images, picture's worth 1,000 words. When you look at our existing technology and then we all of a sudden compare it to the images that we get with the MAPS and with the MR-Guided Linear Accelerator, our referring docs are completely amazed that this can be done. We're really excited to bring that into our department.
This MR-Guided Radiation Therapy program allows us to lead the world in research. We can bring innovative discoveries from the laboratory in rapid iterations quickly to the clinic so our patients can benefit from these innovations. This degree of precision and personalization has never been available before. This is what we're here for. It's to provide the best care for the benefit of our patients.